Piperacillin Tazobactam is a broad-spectrum antibiotic combination containing piperacillin, a penicillin-type antibiotic, and tazobactam, a beta-lactamase inhibitor. Piperacillin kills bacteria, while tazobactam protects it from bacterial enzymes that cause resistance. Together, they treat many severe bacterial infections. Composition: piperacillin, extended-spectrum penicillin, tazobactam, beta-lactamase inhibitor. Common ratio 4:1, e.g., 4g piperacillin plus 0.5g tazobactam. Mechanism of action: piperacillin inhibits bacterial cell wall synthesis, leading to bacterial death. Tazobactam blocks beta-lactamase enzymes, preventing them from destroying piperacillin. Combined, they are effective against many gram-positive, gram-negative, and anaerobic bacteria. Spectrum of activity: effective against gram-negative bacteria, Pseudomonas aeruginosa, E. coli, Klebsiella, Enterobacter. Gram-positive bacteria, Streptococcus, some Staphylococcus, not MRSA, anaerobes, bacteroids. Not effective against MRSA vre atypical bacteria, Mycoplasma, Chlamydia. Indications: used for moderate to severe infections, such as pneumonia, including hospital-acquired pneumonia, intra-abdominal infections, urinary tract infections, skin and soft tissue infections, bone and joint infections, sepsis and septic shock, gynecologic infections, diabetic foot infections, infections caused by Pseudomonas. Dosage: general guide, adults 4.5 g for every 6 to 8 hours, depending on severity. Dose adjustment required in renal impairment children. Dose based on weight, mg/kg, given by 4 infusion only. Side effects: common diarrhea, nausea/vomiting, rash, injection site pain. Serious, less common allergic reactions, kidney dysfunction, low potassium, low platelets. C. difficile associated diarrhea. Contraindications: known allergy to penicillins, beta-lactams, or components of the drug. Caution in kidney disease patients. Precautions: adjust dose in renal impairment, monitor kidney function during therapy, use cautiously in allergic patients, watch for signs of superinfection. Pharmacokinetics: given IV, widely distributed in body fluids and tissues, eliminated by kidneys. Half-life: increases in renal impairment.